It is World Mental Health Day today, and the theme for 2023 is mental health as a universal human right. Now, Mental Health Day is observed every year on the 10th of October. It is a day that is essentially dedicated to creating awareness about mental health issues. Like I said, the theme this year is mental health, a universal human right. Today, we're going to talk about access, affordability, awareness, and most importantly, eradicating stigmas and myths that surround mental health in our country. Joining me this morning, we have a very special guest with us. Dr. Roderico is with us. He is the WHO representative for India. Thank you very much for being with us on NDTV this morning. I want to begin, of course, by asking you about the significance of commemorating World Mental Health Day. Why do we need a day like this? What was the idea behind it to begin with?
Well, I think I'll start with what is good mental health. We know that good mental health is actually vital for our overall health and well-being. In fact, the WHO definition clearly says it's not just the absence of infirmity of disease, but an overall holistic wellness, and that includes mental health, which affects the way we feel, think, act, deal with stress, and how we relate with others. It improves our decision-making and fosters resilience. It enables us to bounce back from certain changes or even setbacks. Good mental health drives good decision-making and determines the choices we make every day for ourselves, our health, our families, and people around us. Good mental health is important at every stage of life, whether it's your childhood, adolescence, adulthood, because it shapes us as a whole, who we are. Yet we often forget that 1 in 8, I repeat that, 1 in 8 people globally are living with mental health conditions, which can impact their physical health, their well-being, and how they connect with others and their livelihoods, how they live life. So when that is missing, we are in a huge problem. I mean, it's almost invisible problem. It is only through the COVID-19 pandemic, which affected everyone's mental health. We all have our own COVID-19 coping story, and this made us realize the importance of good mental health and well-being, how we can stress, de-stress, give ourselves me time, and how it impacts our daily lives. So World Mental Health Day is that opportunity for us to talk about this, to prioritize actions, to promote mental health. It brings us all the stakeholders, and stakeholders is such a huge word. It brings all of us as regular people to take forward the agenda of mental health promotion, prevention, how it is managed, whether it's a primary healthcare center or a health facility that is secondary or tertiary, and palliation of mental health conditions and disorders.
The next question that I want to ask you, Dr. Ofrin, is the theme this year, mental health as a universal human right. What's the sort of thought behind talking about mental health and human rights in the same sentence?
So we always say health is a human right, education is a human right, even food security is a human right. But we rarely talk about that specific part of health, which is mental health. Mental health is a universal human right. Its goal is to improve knowledge, raise awareness, and drive actions that promote and protect everyone's mental health as a right, because we rarely assert it. I think that's the idea, that if we feel depressed or anxious about something, we ourselves as individuals should feel that it is okay to express this and seek any treatment. Everyone, whoever, wherever they are, has a right to the highest attainable standard of mental health. And I think that begins when we ourselves understand that this is a right and that we're able to ask or demand that this condition deserves a right to available, accessible, acceptable, affordable, good quality care. So having having a mental health condition should never be a reason to exclude someone. This is the other part of it as a human right. Should not be a reason to exclude people. If they are discriminated against that, then it's a violation of a human right. Yet people all over the world with mental health conditions experience a wide range of human rights violations. They're excluded from community life. They are discriminated against, laughed at, while many more are not enabled to access mental health care that they need or can access care that violates human rights.
You know, it's very interesting, Dr. Ofrin, because you're talking about accessibility and affordability, and these are two themes that are often discussed in context of World Mental Health. But what about acknowledgement? And what about the India context? Do you think acknowledging mental health as a problem, as a challenge, as a disease is still something that is lacking as far as the Indian context is concerned? And what more do you think needs to be done to further this cause in the Indian context?
So I think that's a packed question, so I'll unpack it. Let's talk about first what has been done, because there's a lot. The government of India has taken several initiatives to promote mental health. There's the National Mental Health Policy as early as 2014, which may be again reviewed and looked at. The Mental Health Care Act of 2017, the National Mental Health Program with a well-defined district level component. So it's not just a national thing. It goes down to the district level, and the Mental, Neurological, and Substance Abuse Disorder Package available free at community level and health and wellness centers. So that service is available at primary healthcare. That's huge. Another big innovation, again, because COVID is such a turning point for all of us, is telemanas, which is in short for tele-mental health assistance and networking across states, which I love the play of words. It's mine, It's one of the country's flagship programs, and the uptake is amazing. Anyone can call toll-free to the Telemanas helpline 14416 or 1-800-89-14416. I'll repeat that, 14416, 1-800-89-14416 for any guidance on mental health. So even if you feel sad and you need someone to talk to, you can do telemanas. Call this number, and there will be trained counselors, and when required, you are escalated to a higher level of care, whether at the district or at another tertiary level. But of course, you know how big India is and how varied it is. It seems that it's never enough. There's always more to be done, as with any sector. We need to further strengthen that connection of referrals. Maybe more counselors need to be trained. We also need to simultaneously promote mental health awareness in communities, because the issue also is social stigma. If right at the outset, someone feels that they would censor themselves from even declaring how they feel, that they feel depressed, that they feel in fear, which is abnormal fear of something, then we've already done a disservice to mental health. I think that's the biggest part, is to work around this stigma. And that's why that theme again of mental health as a human right. It is your right, so it's good for all of us to voice. And also, if we can be the voice of others who have mental health disorders, that is just as important. So if there's anything to do, it's not always just the government, but also ourselves learning more about how we can help around the issue of mental health.
Sure. I think, which is the reason, this conversation is perhaps the reason why we need days to commemorate things like mental health. It is a day that is geared for awareness, for accessibility, for affordability, and most importantly, for acknowledgement of this as an issue. Thanks very much, Dr. Ofrin, for joining us here on NDTV. That's all the time we have. Thanks for tuning in.